Hi, I'm Dr. Jeff Waldron. Today I'm going to talk about 4 things that you need to do with having a total knee replacement. The first thing I'm going to talk about are some of the exercises you should do before you have the surgery. The second thing are the exercises you should do after you have the surgery. The third thing is your gait mechanics, how to correct the way you're walking, how to measure and use a walker or a cane while you're recovering from the surgery. And lastly, what I'm going to discuss is some special considerations around knee replacement with regards to icing and some of the other things you need to do to help your healing time frames. A lot of times your surgeon wants you to have a little physical therapy and do some exercises so you're a little stronger, you have a little better knee range of motion. That improves your outcomes after surgery so that your rehab's a little smoother. So here's the things that your surgeon's typically looking for to help you with that. And there's a lot of exercise you can do, but these are the main ones that will help make sure that your knee's functioning nicely once you have the surgery and start recovering. So the first thing we're going to do, and some of these are going to be simple for some people and more difficult for other people. The first thing we're going to do is what's called a quad set. And a quad set is simply just isometrically turning on your quadricep muscle. You squeeze the muscle so that your kneecap goes up. If you do this and you don't see your kneecap migrate or move upward towards your hip, you might be just pushing with your butt muscle, and that's not good enough. You want to really squeeze the muscle down, pull your toes up, and really engage that thigh muscle so you get a good contraction. If you have a very arthritic knee, you may need to put a towel or something under here at first because it's too painful to push down and do this. So you'll do these for about 10-second holds, repeat, do 10 of them, work through that. If it's painful at first, this is a very safe exercise. You can do it and then see if it calms down right away, because sometimes an arthritic knee, it's going to hurt a little bit. So you want to do the exercise and then back off. If the pain stops fairly quickly, it's probably just a stiff arthritic knee. You could probably repeat these and continue to do it. If the pain is building and getting worse, then maybe you need to just stop doing the exercise. But typically, you really want to train your quadricep and get this going prior to surgery. Lift the toe up, push down, hold for 10 seconds, relax, repeat it 10 times. Once you can do that correctly, then you can add in a straight leg raise. Typically, this is my left leg. I'll point my toe a little bit as if there's a clock down the end towards 11 o'clock. If it's my right leg, I'd tip it towards 1 o'clock position. So I go ahead and put it there. I tighten my thigh, and then I'm going to lift up. You can go halfway up your leg. You can go all the way up to the height of your other knee with it bent like this to protect your low back. You can lay down flat, engage your stomach, tighten the knee, and lift up. And do 10 or 15 of those and continue raising. It's important when you do this that you don't let your knee unlock. So you must master the quad sets first before you do a straight leg raise. Squeeze the knee very straight, pulling the toe up, and then only lift what you can do without unlocking and bending the knee. Okay? So that's the second one you can do to really strengthen up the thigh as you're preparing for surgery. The next thing that you do, and typically I'd take off my shoe for this with a sock, is you want some kind of strap. This is, just a general strap. You could use a dog leash. You could use a sheet at home or something. And you're going to wrap it around your foot. And then I like to crisscross it across the shin here. And then you're just going to slide that knee up and back. What most people do incorrectly is because of the arthritis, their knee will start to bow out a little bit. And so you really want to work on keeping your foot and knee lined up with the hip nice and straight so it doesn't migrate inward or outward. So when you're lying here, you can lie back and you're just going to work your knee range of motion up and down. So you assist pushing down with the top, and then as you're coming upward, you're pulling gently and using your hamstring to work on flexing that as high as you can without too much pain. So just work in a comfortable range. Don't get in there and jar the knee and make it all swollen and aggravated before surgery. You're just trying to lubricate the joint by getting some gentle blood flow and what's called synovial fluid in the joint, turning over across those joints and just working and getting as much range of motion as you can prior to surgery so that you get easier range of motion with that brand new knee once you've had the surgery. So you can do 15, 20 of these several times a day. Very gentle exercise that you can do, okay? The other thing that I like to see, besides working the quadricep, is how strong your hip muscles are on the side. So I would do this on my left hip if it was a left hip surgery, or you could do it both sides. You can lay on your side and you're gonna roll your hip very far forward, keeping your hand on your butt. If you roll backwards and do this, that's gonna be too easy. You keep the hip forward and you put the foot in a horizontal plane, you bring it back, and then you're just gonna kind of lift gently up and down, tightening your stomach, protecting your back. And you could do 10, 15 of these, couple sets, get that glute muscle nice and strong to help with balance and power for that knee. So you can do these prior to surgery. Once you've had the knee surgery, you may not tolerate this exercise for several weeks. But pre-surgery, this is a good one to work on and get your hips strong before you get into that. The other thing you can do is you could get in and start doing some bridges and strengthening your hamstrings before you go into surgery. Be careful if you have arthritis in your knee, you may have arthritis in your back. So be careful and engage your stomach when you're doing your bridges as well, like this. And then the last exercise I really like that's helpful right after surgery and also before surgery is to get a band. If you have tubing, you can use that, but this wider band tends to work a little better. You can take it, hook it around your knee, and then tie it around your dinner table or something that won't move. I'm going to use just a leather strap right now for this machine that I have in the clinic, but you would do the same thing with just a band at home. It's quite simple. And you get this behind your knee. It's called the terminal knee extension. And this is just like the quad set. We're building on all the prior things we were doing. You're going to go ahead and let your ankle come off the ground, and you tighten the front of your knee and push your heel down onto the ground, tightening that quadricep. I'm also shifting my weight onto my right foot. So I go left, now I'm shifting right and pushing weight down through my foot on this side. I go back and forth here, and this does a couple things. It gets me used to weight bearing on this arthritic knee because it's been hurting. You may have been shifting your weight during your gait off of it. So now you're going to encourage your body to turn on those muscles with shifting your body weight on. It's kind of like you're doing a little salsa dance back and forth or something. So not too much hip action here though, but you're going to just shift your weight over and squeeze. Shift and squeeze this quadricep and turn on the muscle. Okay, so these are some of the exercises you can do pre-surgery that would be helpful. After surgery, some of the exercises are going to be similar to what we just did, but initially the first few days, the main objective is getting that quad set going. So you're going to lie down and you're going to really work on squeezing this muscle and doing these quad sets. Remember to pull the toe up, squeeze. You want to see the kneecap go upward. This is important. Squeeze, feel the kneecap contract and go upward. You can practice on your other side. Sometimes after surgery, you're having a hard time initiating the muscle. It's painful. You'll want to do the other side as well, and then come over and see if that helps initiate and get the muscle going. You can put a towel under here if it's too painful to get that movement, but eventually you'll want to shift the towel down to this end so you can get your full extension. Be kind to the knee. They just drilled down into your bone, and so you're going to have some bone pain the first 6 to 8 weeks. So you really want to be gentle, respect the pain, and just do what you can tolerate without too much discomfort. But get that quadricep going, practice several times a day doing that. The other thing you're going to do a lot of are these heel slides that I went over. So you're going to do these several times a day. I can't stress how important it is that you don't yank and be too aggressive. You want to just kind of work through what's comfortable. The first couple weeks, you're maybe going to get to about 90 degrees. After that, your knee will feel more comfortable and start to allow you to bend it higher. You should be in physical therapy at that point and be getting some guidance around these exercises and how to do these and how to time them, but really do not be too aggressive early on. If you are too aggressive, you're going to kick up more inflammation, you're going to create more scar tissue in your knee. So just allow your knee to gently work through and start to improve. So those two exercises are going to be the key, the quad set and the heel slides. As you get out a couple weeks, you may be able to do the leg lifts, or you may be able to do the band exercises here, this terminal knee extension exercise where you're shifting back and forth. You have this attached to your dining room table or something like that, and you're working through your weight shifting and getting some of that going. So those are the main ones. You may be sitting and sliding your foot back and forth in a chair and working your range of motion like this as well the first couple weeks. And then as it gets better, you'll be able to progress and do the leg lifts and some of the more aggressive ones. But in the beginning, it's very important that you work on your fundamentals and get a good quality contraction in this thigh muscle, because they're cutting through the front of the knee. All of that gets impaired and shut off, and so you need to turn it back on and get it going and get it comfortable. Right after surgery, the majority of people are going to be given a walker so they don't fall at home getting around. It's important that you're on a level surface at home and you're not having to go up and down stairs, because you're not going to be able to do stairs properly. So you want to have a bed or things set up ahead of time where you have a bathroom and everything all on one level, and you're not having to go up and down the steps at home. So with the walker, you're going to want to be careful with walking with these, that you're not leaning too much and you're starting to get comfortable in weight shifting. If you had surgery on, let's say, the right knee, a lot of times people are leaning and they're fearful to put weight on it. So you want to practice bending the knee and advancing it forward. Bending and advancing it forward and shifting your weight onto that side as you step forward. With your walker, it should be measured for you before you leave, but typically you want it right at your wrist break here, and it should be at that height so that when you lean on it, your elbow's bent 15-20 degrees. That way you're not shrugging and using your neck if it's too tall, or you're not stooping down and it's too low. So just standing up nice and straight, the wrist right there on the side should measure up where it's at. Once you're walking for a week or so, you may start to feel more comfortable without that, and you may shift to a cane. When you shift to a cane, same thing for measurements. That cane should be right at the wrist break there, so that when you grab it, you have a little bit of bend in the elbow. If it's your right knee, you're going to carry the cane in the left side, so that you step with the foot and the cane at the same time for stepping. But it's important you don't advance too quickly and risk having a fall. So stay with your walker until you're comfortable enough to move and you're not at risk at falling. And then you should have a physical therapist helping you to know when to shift over to a cane from the walker. And again, staying off the stairs until you get assistance with that with a physical therapist and someone that can protect you with getting up and down on the stairs. Special considerations having this knee replacement. You really want to be set up at home right when you get home with a couple of really important items. One thing I like to see people get is some kind of ice pack. This one's nice. This is called Elastogel. I don't care what manufacturer you get. These ones are pretty safe to put right on the skin without getting a burn. If you're worried and your skin is a little thinner, you could put a pillowcase or something as a barrier between the ice pack. But these ones I've routinely used for 20 years in clinics, and they're really safe to use. They have the Velcro straps, so these are really convenient to wrap all the way around the knee and Velcro in place so that they don't, move or cause any issues. Really comfortable. They stay cold 20-30 minutes or so, and then they start to warm up, and then you put them back in the Ziploc baggie they came in and put them back in the freezer. There's a lot of research around using these machines, which are called cryo-cuffs, and you fill them up with ice partway, and then the rest is water, and then you close them, and you can take this and same thing, you strap this with the Velcro around your knee, and then you could leave this on for several minutes, sometimes an hour or more. You can put these on. Again, take it off intermittently, check your skin, make sure you're not putting too much cold on there and injuring your skin or creating a cold, what we call burn on the skin. But these are really great for reducing the amount of pain medication you need to use and really controlling that swelling right after surgery. What is really helpful to do with the knee is to have some kind of bolster, or you can fold blankets or comforters on the end of the bed. People come in and they say, well, I've had my knee elevated. I'm up in the recliner and it's sitting like this, and that's what I'm doing for my swelling. And they come in with a very swollen knee, swollen calf, and I tell them I want it up above your heart. So you need to be lying on your back and you need to have it elevated this high. This always surprises people, but if you get it elevated this high and we control your swelling, then you're gonna have less pain. We're gonna have more range of motion because you don't have all that fluid in there. And elevating it like this a few times a day will really help you get ahead with recovery from that knee surgery. So I'd elevate it like this, put the ice on. You could also elevate it and do some ankle pumps to minimize getting a blood clot or pulmonary embolism in there. You can do your ankle pumps for your knee. You can do the pumps on both sides. But this is a great way to allow gravity to push some of that swelling out. The other consideration is that people will have their surgery and they'll start trying to work. They'll sit at a desk. Let's say they're a couple weeks out and they go, oh, I'm going to sit at my desk and get some work done. And they're sitting, and this is a dependent position with gravity. So what happens is the knee stiffens up and it just starts to pool with blood and swelling in the knee. And then they'll come in and they'll have a real stiff knee because they sat for an hour or two and didn't get it elevated. So right after surgery, your knee's gonna like, if you're walking and moving, the pumping mechanism of your muscles pushes the swelling out of the knee and up and out of your body. But if you sit for a long time, you stand for a long time, then all of a sudden you're gonna get blood pooling and that knee's gonna get very stiff and angry. So short bouts of walking. So I tell people, okay, you can walk a block or whatever you feel comfortable with around in your house a little bit, and then you need to elevate it and do your exercises. So you're breaking up your day with several bouts. I tell a lot of my patients, they're 2 or 3 weeks out, I want them to stay out of the big box retailers. I don't want them in Home Depot, Costco, or something like that, where they walk a long distance in the parking lot and then they're walking around for an hour or more in that big store, and then they show up for PT and their knee's stiff and they're lacking range of motion, and they just set themselves back a week in their rehab. So it's really important that you adjust your expectations, you get the proper help at home so that you're not up for an hour cooking and standing on this. You have maybe food prep ready in the house ahead of time so you're ready to go with that knee replacement, and you can do all the things you need to do to take care of it. So I encourage you, be on one level, have a bathroom close by, have a way to elevate it, have your ice packs and everything ready for you, because those surgeons, when they go into the knee, they're going to take a drill bit and they're going to drill down the center of your femur, and then they're going to stick a prosthesis that's on a shaft down the center of that and set it right on there. Then they're going to drill down your tibia and they're going to do the same thing on that side. We know that fractures take 6 to 8 weeks to heal for bones, so you can think about, with all this stuff they're doing, we're having you walk on it right away. It's a very successful and a very good surgery, but you also need to keep in mind that it's a major procedure, and you need to be taking care of that bone and taking care of your swelling so that you don't have issues after this. So a little bit of precautions early on and patience, being patient the first 6 to 8 weeks is very much key. So those are the things I want you to think about with this video, and I hope it helps you in your prehab, so pre-surgery with the exercise I gave you, your post-surgery for the first 6 weeks, and then some of the gait training's helpful as well, and then also the special considerations so that you're managing your swelling and your lifestyle right after surgery for the first 6 weeks to help, and you're getting better. And keep in mind, you're going to be much better at 3 months, 6 months, you're even better, but you still can get some swelling pain for up to a whole year after this procedure. So just make sure that you have your expectations set right and you're ready to take care of yourself with this surgery. So if you found this helpful, please share it with other people, and click subscribe if you're following this on the YouTube channel. So I appreciate everyone watching. Thanks.